It's official. Welcome everybody to my YouTube channel. Guys, I am so happy. I am honestly really very happy because I have a very special guest with me today. And I am going to be interviewing my special guest in the name of Miss Tyeisha Washington. She's an acute care nurse practitioner all the way from Iowa. Please meet my new very good friend, Miss Tyeisha. How are you, Miss Tyeisha?
I am good. Thank you so much for having me.
You are very welcome. You are
Thank you.
very
Thank you.
welcome. Very welcome. Miss Taisha just concluded a mentorship program with me. She went through 5 weeks course of mentorship with me. And in the course of my mentorship, everything that she does, even say the way she carries herself, everything just stood out to me. And I sent her a special invitation to join me today so I can showcase her and everything special that she has to offer. So without further ado, Mr. Yusha, are you able to tell us who you are, your name, where you're located, and everything else?
Yes. So, as I said, I'm Tyeisha Washington. I am an adult gerontology acute care trained nurse practitioner. And that is basically being trained as a nurse practitioner in acute care, internal medicine, critical care settings within a hospital base. I'm located in Iowa City, Iowa. My exact address, if you want to come by and see me, is
Mhm.
439/441 Highway 1 West in Iowa City, Iowa.
Iowa. I like that. I've never been to Iowa, guys. So I'm
It's
gonna
nice.
be
It's a
there.
college town, but it's pretty laid back. It's nice.
Yes, 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 yes. So, Big Taisha, tell me a little bit of what you do. What's your background? What do you do to be precise?
So in my clinic now, I do a combination of treatments and therapies. First, I'm gonna highlight my primary care, which is focused on adults with chronic illness that are looking for more holistic wellness, as well as having some internal medicine, like your primary care, still built in. As they age, these things kind of go hand in hand and looking at how to improve their quality of life. So that is in my primary care, which is Washington Adults Clinic. You can find me there also at www.washingtonadultclinic.com to get further information. My phone number and everything is on that website as well. The second branch of my treatments and business is Glow Hydration Station, which was founded in 2021, which focus on vitamin therapy for chronic diseases as well. I also do medical weight loss in there and treating skin conditions as well. And so if you see my little glow there, I also kind of help individuals that have acne, wanting to, your face is your is the first thing people see. And so some people have acne or skin conditions that leave them self conscious. And so we work on those as well.
I like that. So I'm gonna quickly take you back to where you started from. You mentioned
Yep.
traditional medicine.
Yeah.
So I'm gonna focus on, I see the eye glow and I see
Yeah.
you glowing. We're gonna get to that. I like that. You're gonna tell me a little bit about the glow, but I want to quickly talk about the Washington Adult Clinic. You
Yeah.
mentioned that you do traditional medicine. Are you able to walk me through your day-to-day? What is traditional? Like for those of us that doesn't understand traditional, like what is that though? Like can you
Yeah.
walk us and give us like an overview of what that is?
Yes. So when I have a new client, a new intake that come in, I carve out 90 minutes for new clients and get an understanding of what their goals are and what they're looking for. I am stepping away from the modern medicine world and kind of looking at how can I enhance and improve individuals' quality of life. And so I'm tailoring my training, my knowledge to what that person needs. Instead of having them lumped in with everybody, I am tailoring what to their needs. And so I request that they bring in all of their medications, including supplements that they are taking. And we sit down and we look at those medications together. As I'm going through their medication, I am looking at how can I de-prescribe, which means take away medications that they don't need, that is becoming a pill burden to them. And so we sit down, we look at their medications, we carve out what is pretty much needed and what things may be considered a burden or was added to cover the symptoms of another medication they're taking. So I'm trying to get rid of pill burden with them, enhance their quality of life, and improve the symptoms that they are having from pretty much having so many medications on board.
Oh my gosh. Did you guys hear that? I don't think you guys heard it again. Let me ask her to say it again so you guys can understand. Listen, there is a reason. When I say special guest, I want you guys to sit tight. Like, you got to sit tight now because I want you to hear this. And these are the things that I said that stood out to me when I was working with Miss Client, my client, Miss Tyeisha here. Did you just say, Miss Tyeisha, you spend 90 minutes with your client?
Yes, ma'am.
Right. A lot of us are very used to prescribe, because that's what we've been wrapped around, like prescribe,
Yes.
thinking this. But in your own clinic, Adult Family Washington, like Washington Adult Clinic, you guys
Yes.
just prescribe and you get rid of medicine. Okay, so when you
Mhm.
get rid of medicine, then what do? Because you describe those things. So what do you then replace with those medicines that you took away?
Some of them are nothing because as individuals age, you actually need to get rid of medications because they are not filtering it. So I'll give you an example. This may be a little bit easier for some to wrap their head around. I have a 56-year-old client that came through looking for non-traditional medicine. She has her chronic diseases, COPD, which is a lung disease, CKD, which is kidney injury to her disease, kidney injury, type 2 diabetes, which she's obese, and so she was put on that medication. And so her main symptom or main concern when she came to me was, Tyeisha, I am taking this pill and I am taking 900 milligrams of it 3 times a day. And then they added another pill to essentially help do the same thing that these other pills are doing. So 900 milligrams, if anybody knows for gabapentin, that's a lot. That is 4 huge pills that she's taken, I'm sorry, 3 huge pills that she is taking, and she's taking them 3 times a day. And then she's now added on another one, and her symptoms are she's still in pain. So it didn't really help her at all with it. And so we sat down, we looked at her medication, and I slowly titrated her down from those medications, and I introduced an IV infusion. That's where my Glow Hydration comes in. I introduced an IV infusion that I customized for her that targets neuropathy pain. And within about a month or so, I had her off of her medication. I think actually it was about 6 weeks. I had her off of the medication, and now she comes in once a month for one infusion, and improved her quality of life. And now she's able to be more active with her 4 and 6-year-old grandkids.
Wow. This is very immaculate. I want to commend you, Ms. Tyeisha Washington, for, even doing this at all. Like, I feel like 90 minutes is a lot of time. And you're
Mm-hmm.
telling me that you were able to help this your particular patient who is taking symbiotic gabapentin. You was able to reduce all of her pain at least to about 80%. And now she's able to go back to her kids and have a better, healthy life by
Yes.
just introducing IV infusion and describing and taking away all of those unnecessary medicine. I think that's really immaculate. and very neat for you guys to have that in your practice.
Yes.
Very good. So I see glow right there, and I also see that
Yes.
you're glowing, like help us understand. Like we also want to glow, okay? Like as you can
Yes.
have all this.
Yes.
How can I glow? Like what is glow? Can you tell me a little bit about glow? I glow.
Yes. So, Glow actually came about due to an illness that my daughter was diagnosed with, lupus and rheumatoid arthritis. And so she went in, not taking any medication, very physical, like physically fit and athletic wise. And it became debilitating where she wasn't able to continue with sports. And so we went in, she came out with 12 medications, basically had to leave school, come home, and me and her dad was her caretaker because she couldn't essentially do much of anything. And the science part of me, but also the mama bear in me said there has to be something else out there. At the time, I didn't know what, but I knew it was something else. And so I started doing research and more research and more research. And so, being in Iowa, we are, as a nurse practitioner, I'm an independent practitioner. So I was able to register with pharmaceutical companies and get a shipping mailing address and be able to order medication. And I started treating my daughter at home. And by doing that, I was able within 3 months get her off of half of her medication. And by the ninth month, she had no medication and she was only doing IV infusions at home. And then I branched out and got a brick and mortar. And then I discovered that, you know what, if I'm able to do this and help my child, I can tap into a whole new need in my community and help others. And so that's kind of how Glow developed and was born. I like to say is how Glow was born. And so now I tailor and I customize IV infusions based off of the individual's needs for chronic diseases. And then those that may not have chronic diseases but are looking for enhancement in the sense of like wanting increased vitamins if they are doing RAGBRAI or bike riding, or they are one of the athletes from the college that's looking for just saline to be hydrated because they have been working out in a hot sun. And so I kind of tailor those. What's given me my glow in particular is I have a infusion that's called Inner Beauty, which focuses on biotin and collagen and your amino acids and peptides that I blend together. And then I do those infusions along with your facial. And so after a while, you get this little glow.
Mail those, or do we have to come to Iowa to get those treatments?
So these treatments, yes, you would have to come to Iowa. However, I do have a partner with a vitamin company that I've been with now a little over a year and a half. That I introduced to my weight loss clients as well as my non-weight loss clients, that gives you vitamin supplements. They're the only vitamin on the market that you have a 90% bioavailability, which means 90% absorption of the vitamins. They also have released all of their epigenetic studies and their research. If you hear me saying this quite often throughout this interview, is I'm very big on research. And that's, I feel like if an individual understands the root of why they're taking what they're taking, they have a better outcome. You're not just putting anything in your body. And so I'm very big on that. And anything that I have and I do in here, I have tried on myself first. So I stand by this. This is actually, I wish I would have had them over here. I could like show you the vitamins, but yes, we can partner together, and that standpoint at a distance. Then I can send vitamins to you, and you can open your lovely box and take them at home.
I think I'll tap into that, and I encourage you guys that are watching us to, as you can see, Miss Tyeisha is actually huge in research. I'm also a researcher. as my background. And I
Yeah.
like the fact that you mentioned that even, tying all of this to your daughter's experience. So you went from, helping your daughter 6 months, she was down to 3 medicine afterwards when you started this infusion type of treatment. So I really think that's key. So you started your research and you came across all of these medicines, even you mentioned John Myers and all that. So I
Mhm.
think that's cool. So, Miss Tyeisha, I know you came to me for DOT,
Yes.
physicals and all that DOT.
Mhm.
So, can you tell us a little bit, like, what are your services and why did you transition or why did you include a DOT into what you do?
Yes. So for Washington Adult Clinic or Washington Clinic, I see a lot of primary care clients as well, and I do state exams and veterans exams. And so, doing those exams, I was being asked, "Hey, do you do DOT?" Either testing or do DOT physicals. I was getting those questions in my inbox and like messengers. Some of my clients that come in, husbands or spouses are truck drivers, and was asking. In my area, there is a large population or a large, we have kind of quite few manufacturer plants here. And so truck drivers are in the area quite often. And so my father also was one. And so I was aware of it, but didn't know a whole lot about it. And so it was a need.
Mm.
Individuals didn't know where or how to get the services. And so I said, well, I think this is my calling to go for it. I've earned the trust of the community for their other medical needs. And so I say, why not add this service? And so as everybody, you go to, MD Google and you kind of try to find service or people who are training and so forth. And so I stumble upon Coach Eli's Facebook group. I joined and I kind of went down that path. I will say prior to taking your class, I went with a different person and was scammed essentially. They did not deliver, and I paid a nice chunk to them. As a startup business, you don't have funds to just give out to people, and so when I saw your Facebook group and all of the individuals saying how they, appreciated your time, the one-on-ones, they came out learning so much, and then all of the free gems you were dropping here and there, and I was like, think she's the real deal. Like, let me just go through it. And I was kind of debating, do I pay the $199 or do I pay the mentorship? Like, what do I do? And I told myself, if I want to take my business to a next level and really truly understand what I'm doing, I'm just going to go big, go home. So I signed up for the mentorship program, and it was truly the best thing. Having those one-on-one sessions, I really felt like it was tailored to my growth in my business and gave me a better understanding versus like, a group setting, which is nothing wrong with that. But I think for me, doing the one-on-one was so beneficial.
I like that. You just took me back to my childhood. I don't know if you guys have heard me say this, it's either you go big or you go home. And honestly, like I said, Miss Tyeisha is just this client. I just enjoy everything. I learned a lot when I was working with you throughout
Yeah.
our 5 weeks mentorship. I learned a lot. Even you remember you sharing that you was gonna go to the church and talk when we were
Yes.
strategizing on the marketings and all that.
Uh-huh.
Really appreciate that, but it's kind of saddens me that some people are still out here scamming people. I just hope you all can learn because again, we've seen all that happen. So, Mr.
Yeah.
Yeager, are you able to give us like a breakdown of the services that you do? How can we like, I want people to know how they can find you, where we can
Uh-huh.
go to find you, and things we can work on. And I also see that you're a nurse practitioner, and I think you are already starting to mention that you are open to partnership.
Yeah.
As far as you being a clinical provider, we are always looking for clinical professionals that we can
Yeah.
work with because of what we do in the clinical
Yeah.
world. So are you open to partnership? And of course, if you are, let us know how we can locate you, how we can find you. I will also put this on your screen, guys. And if you don't mind, also tell us all the list and areas of services that you offer.
Yes. Yep. So you can find me at www WashingtonAdultClinic.com. Phone number is 319-862-2170. And fax number is 319-862-2171. Services that I offer is physical exams, DOT exams. Oh my gosh, I got to look behind me and see here.
Sure.
Everything I can think of. What else is
Yes.
up there?
I see
Physical
IB hydration.
exam. Yes,
Uh-huh.
IV hydration.
DOT physical.
Women's exams, STD exams, TB shots. So you think of when you're going to school, you need a physical for that. I got you there. Of course, the DOT testing exams, pretty much a lot of rapid exams that you need for COVID, flu, influenza, laboratory draws you can do here as well. It's pretty much about everything I can do that is for adults. I do not see anyone under the age of 18. But yeah, that's how you can find me in my services.
Yes, even weight loss. I think I like this. You guys are
Yeah.
just clinic. Oh my gosh. I am, like I said, oh my gosh. Wow. We need to come to IOR. So you guys like a clinic, one-stop shop for everything. You
Yes,
cater
ma'am.
to from IB hydration to weight loss to clear waiver testing. And I'm pretty sure you guys have an EHR system. So everything
Yes,
is
ma'am.
system,
Yes,
patient
ma'am.
portal, all that.
Yes.
Wow. I
Yes.
remember talking about that. That's
Yes.
beautiful. So Washington Adult Clinic has come to stay, guys, as you can see. Oh my gosh, for yourself. That's why I said I couldn't wait. The most important thing that stood out with Miss Tyeisha for me is that they are into more of the traditional medicine, helping people live a better life. As you can see, even with our daughter at this one patient, they were on multiple medicines and now they de-escalated and reduces, like improving lives. Just let's
Yes.
just use that word. And we've
Exactly.
seen how you was able to do that by helping them to from 10 medications reduced down to 2 medicines, improved health outcome, no more suffocations, no more this.
Mhm.
I think you mentioned that your daughter is now living on her own in Atlanta. I think
Yes.
immaculate, when you and your husband was taking care of her, now she's able to do things on her own just because you have that research capacity in you. You can
Mhm.
find things for yourself. And that's what I always encourage people to do. Before you do anything, always goes the extra mile to just find stuff. You will see when
Yeah.
she find. Even God said, seek and you will find. So I just
Mhm.
like that approach. I like that you have this research thing in you. Very
Yeah.
well, very well said. So Miss Tanisha, um, I also want to ask you, how can we help you? Like, what should we do to help your business and all that?
Well, of course, if you're in the Iowa City area or within a 30-minute catchment of me, of course, pick me as your provider. Just because I'm not the same as everybody, your care is going to be tailored to what your needs are, and you will be heard. However, if you're not in my area, that doesn't stop anything, because I felt like I went into healthcare to help others. So helping yourself, visit my website, learn those things on there. There's educational resource page on there. If you find that you have some of those chronic diseases, some of those concerns that you have, take that knowledge and take it to your primary care within your area and voice your concerns and make sure they're advocating for you in that way. Is what I say is the biggest thing. But of course, sharing my business page, sharing my info with individuals in your area. If you're passing through and you want to stop by for some infusions, of course, do so. But more importantly, I think getting information out about holistic healthcare is huge, and it's going to be the game changer that what changes our eyes in healthcare.
I agree with you. It's gonna be the game changer, as you can see, like the two examples you gave, and people are slowly transitioning into all this thing. As you can, because medications is there to detriment our bodies. I don't think
Mhm.
it helps. Even if it helps, it's on the shorter terms. So
Yes.
longevity is holistic. And I like that as a provider, you embrace that. And that's what you're telling us. And that's what you're also practicing. Very good.
Mhm.
So what are your final thoughts before you go though, before you say your final thought? Guys, I want you guys to know that Miss Tyeisha is open for collaboration. And if you want, she mentioned that she has a partner with this IV vitamin treatment company. She can link you up because I am actually going to be your first clientele.
I
And
love that. Thank
I
you.
really need to do some. So I like that we can remotely do all this. We don't have to necessarily be in Iowa to get all of this benefits. So I think we all should tap into that. And all of Mr. Issues will be on your screen. And so what are your final thoughts?
I would say my final thoughts, take home message for anyone that is watching. If you're watching Coach Eli, 99% of the it's a 99% chance you're trying to grow your business or you're trying to enter into the diagnostic world. I hands down say take her course, learn from her because it's not just kind of learning how to fill out a documentation. She's also giving you gems of how to market yourself, how to market your business. She's helping you, giving you templates and giving you material to use to market your business. She's available by text. It was a wonderful experience working with you. So I appreciate you from that standpoint. And then my final thought is if you have this passion, whatever your journey is, whatever your carpet is laid out for you, go for it. Don't hesitate because you may not feel like it is necessary, but you're going to help someone somewhere. And if you help one person, you have truly helped 10 because word of mouth, they're going to share it. So go for it. Don't hesitate. Um, you won't know unless you do it. And what's the worst can happen is your business is not successful and you go back and work for someone else. But if you can get up every single day and give somebody 110% of you, you can give 150% to your business.
Absolutely. I agree with that. I like your philosophy, and that's my philosophy is always to give back, to help. Don't sit on the fence too much. You've heard it. A lot of you are always, you want this. And I'm pretty sure you like everything that you see, Miss Tyeisha.
Yeah.
Most of you are even nurse practitioners watching this, but you're lackadaisical about everything. You're afraid to fail or fall. If you
Mhm.
try, you won't fall. It's better you
There you go.
fall and you pick yourself and
Yep.
fly. It's
Mhm.
okay to fall, guys. Look, Mr. Yisha is a multi-business owner. And she mentioned, Mr. Yisha, you forgot to tell us
Mhm.
this. What
Ah,
future projects? What is coming
yeah.
up next? Let us know. What is
Yes, my future project, I'm in the process now. When I actually get off this call, I have another call for it, is I am opening a training center, which will be a certified nursing assistant, medical assistant, licensed practitioner, phlebotomy, and then teaching classes for CNA, BLS, and so forth. And then it will have a platform open for the community to come in and learn more about their chronic diseases, which will be heart failure, diabetes. So I'll have specialists that will come in from the community to talk.
Listen, people are, she's actually doing a multi-collaboration. She's going to teach you how to become LPN. So if you're a CNA looking to go into LPN, or even you're just from high school, you want to become a CNA, you want to transition into healthcare. So I love teaching. I love everything. Like I said, I told you that I love everything about Miss Tyeisha. And I
Yeah.
think people will come to Iowa to take your course, to come to your school, because that is a solid foundation right there. So
Yeah.
you've heard it all, y'all. That's Miss Tyeisha. I hope you guys will reach out to her. Go visit the website. She has a lot of resources that you can even learn on holistic. I encourage you with your new endeavor on the school thing. I want to be
Thank
a
you.
partner. If you let me, I like teaching. We're gonna figure
Yeah.
something out. Okay.
Yeah.
So guys, networking is key. I encourage you to network Miss Tyeisha. She has a huge wealth and knowledge on health. She is an acute nurse practitioner. She has multi businesses. Glow is one,
Mhm.
adult clinic is another, and she's on a third journey to open medical
TID
PID.
Schools of
Oh,
Career.
I can't wait. That's fire right there. That's fire. We are
Yeah.
burden. We are, schooling, giving people education, licenses to start their journey is just
Yeah.
I can't wait. So we're probably gonna bring you back, Miss Tyeisha. But
I
for
love
right
that.
now, we got to go, guys.
Yeah.
Thank you all so much for watching. Make sure you stay and subscribe because we have more to come. It is your girl. Bye for now. Bye,
Bye.
everyone.